In this 21st century, business ownership is not an option, but rather a necessity. So let me ask, are you tired of working for someone else, lining their pockets from your skills and sweat equity? Are you ready to use your drive and ability to own and operate your own personal care business? NBHS of Georgia has helped hundreds of everyday people, including nurses and healthcare professionals, retire early, turn in keys and badges, and realize a lifestyle they never envisioned. Don't just take my word for it. Allow successful entrepreneur, personal care business consultant, and registered nurse, Mr. Ernest G. Flagg, to tell you himself.
Okay, welcome. My name is Ernest Flagg. I'm with Nursing and Behavioral Health Services, and right now I'm going to focus on the best business ideas for nurses and people in healthcare. You know, the U.S. Census Bureau really has done the work for us. In their statistics, they have looked at and found that by 2030, some 20% of the U.S. population will be age 65 and older. That is absolutely good news for all of us, because all of those individuals, which is a plethora of individuals, there being 325 something million U.S. population, and 20% of that is a huge number. That says that all of those individuals will not be able to live in their homes. All those individuals of those individuals that can live in their home, many of them will need support also. And while in their home. And for those not in their home, they're going to need some other form of housing and assistance as well, and supports while in the community and living outside of their home. It is time that we no longer just sit around and talk about business opportunity, waiting on opportunity to just fall into our lap. It is time that we go out and create opportunity for ourselves. That is what time it is. The writing is on the wall, has been there for a long time now. We're working, making other people rich, lining other people's pocket, but from our sweat equity. You're working for individuals that are far less intelligent than you are, and you're putting in so much of you into that job, into that situation that belongs to somebody else, and your value truly is likely not even appreciated, not recognized, and not even appreciated in most instances. And then ultimately you retire. Your back is out, your leg is out, your eyes gone, you got hypertension, diabetes, you're blind in one eye and can't see out the other, and then they tell you can go ahead and you can retire now. What kind of life is that? I'm talking about the opportunity here to realize residual income. That's money earned while you're away from the job. Money earned while you are asleep, being able to take vacations and come back when you get back. I mean, that is an option. That is an option. That option exists, and that opportunity is there for you. If we look right here at the numbers, let me see if I can get this. Get this little. Here we go, right here. 2030, year 2030, and we're looking at about 20.3% here. And that's taken directly from the U.S. Census Bureau. Specialty group homes. That's your hospice facility. That's your DD, IDD group home, your veterans home, your medically memory fragile home, your children's residential group home. Specialty. And when we talk about specialty, this is something totally different than the norm. These are all specialized types of environments, specialized facilities. Private home care. You're sending nurses and aides out to individuals' homes. You can expand this model and include assisted living facilities, hospitals, subacute care facilities. Hands-on, skilled nursing involved in this particular model. It's like a staffing agency. companion care company, you're sending direct care workers or certified nurse assistants out to people's homes. Generally, this is hands off. These individuals assist with maybe hygiene and grooming, medication reminders, running errands, and as well assisting with keeping the residents clean and, of course, ensuring the health and safety of the individual client. Transportation company. With this, you're moving products and even humans. You're sending people to, taking individuals to essential appointments. But I'd like to see this model expanded for some of the people that want to come and talk about getting contracts with UPS, FedEx, and even going through Medicaid waiver program for certification purposes, and stirring up business in that particular arena. The small nursing homes, we're talking about 50 to 100. It's manageable. Your assisted living home, caring for individuals who are higher functioning, and you don't need 24-hour care, 24-hour staffing around the clock. Staffing is not necessary, but it can be the case. You might do 6 hours, 8 hours, or 12-hour staffing in this particular model. The adult day program. Individuals are coming to your facility, to your business, and they're staying for maybe 6, 8, 10 hours a day, 12 hours a day, and then their loved one or family or spouse will come back and get them ultimately at some point throughout the day. But while they are with you, they're participating in a variety of activities. They're not just babysitting. This is not a babysitting type of environment because it's very dangerous. It's not, things can happen. It can be unsafe if it's not properly ran and monitored, etc. But a very lucrative business as well if it's put together right and run properly. Professional services. This is a consultation type of business setting. So if you're a nurse, doctor, nurse, you have a certain set of skills, you can create a consulting agency and market those professional services that skill set that you have. You can market it. You can market it on a statewide or even a national level. Health product store. So you got a website, and what you're doing here is marketing that hair product, that lotion, those vitamins, those minerals, whether it's 1 or 100 products. You're marketing them on a statewide or national or international level. And this is your staffing or your traditional staffing agency. You could staff nurses, you could staff doctors, you could staff NPs, you could staff OTs, PTs, or even secretaries, direct care workers, or even aides in this particular model, and sending these employees, 1099 employees or contracted employees to various entities such as hospitals, nursing homes, home care, home health agencies inside of different types of healthcare establishments. And of course, you're billing for the labor, the amount of time that the individual is at that particular site, work site. And supported employment agency. Here you're training individuals on how to do a certain job and how to perform that job correctly, and also providing counseling services or coaching services while they are on their job to assure that they get to the end of the day or get through that job with as less stress as possible and occurrences. Community access program. With this particular business model, you're taking individuals into the community and reacquainting them with the community, and such as the library, grocery store, or even use of public transportation. Yeah, it's a business model, all right. And that's all, folks. My name is Ernest Flagg, and please visit our website, sign up for a consultation, and let's start working on your program and getting your particular business up and running.